How to live with kidney disease. My name is Ellen. I am a retired registered nurse and have worked in and out of the dialysis field since 1968. I have worked in hospital dialysis units, outpatient dialysis units and home training units both for hemodialysis and peritoneal dialysis. You may have been told you or a loved one have chronic kidney disease (CKD) or chronic renal failure or end-stage renal failure (ESRF). This may have been expected or a shock for you. No matter which, your life will change as you deal with chronic kidney disease and possibly your kidneys failing. In this video I will be covering what your kidneys do for you, stages of chronic kidney disease (CKD), things you can do to slow or even halt the progress of CKD, treatment options for end-stage renal failure, ESRF. The term renal refers to the kidneys. Our kidneys are so efficient that you can lose 90% of their function. That is why many people don't know they have renal disease (CKD), chronic kidney disease, until the damage has been done. Or even ESRF, end-stage renal failure, until they have symptoms, or it shows up on a blood test when they see their doctor. What do your kidneys do for you and what do you lose when they stop working? Your kidneys are found on either side of your spine below your ribs and behind your abdomen. They are around the size of a clenched fist. Your kidneys may be small, but they do an awful lot for us. It's not just making urine, removes waste from the body, regulates the body's fluids, release of a hormone renin that helps control blood pressure. Vitamin D3 activation promotes calcium absorption, which plays a part in building stronger bones. Release of a hormone called erythropoietin, which aids the production of red blood cells in the bone marrow. Assists in excreting drugs from your body. Chronic renal failure or chronic renal disease usually progresses slowly. It is measured by stages from 1 through 5. The stages are based on something called glomerular filtration rate, eGFR. Chronic kidney disease stages. Your options depend on what stage your failure is at. Your doctor or nephrologist, a doctor who specializes in renal disease, will tell you what stage you are at. If your disease is found in the early stages, following the advice of your doctors, nurses and dietitians, you may live for many years with CKD and not progress to end-stage renal failure. If your disease is found later and you are at a higher stage, you can still take measures to try and slow the progression to ESRF, but the progression time may be shorter. Once you get to stage 5, that is end-stage renal failure, and there is no further to go, you will require treatment to live. It is called renal replacement therapy. The less you do to help yourself, to stop the disease progress, the more likely you will be to end up with kidney failure. Hypertension, high blood pressure, and diabetes are the leading causes of renal disease. You should aim to keep your blood pressure under 120/80. If you are a diabetic, it is important that you keep your blood glucose in a healthy range, between 4 to 7 mL/L or 100–125 mg/Dl. These are most important things you can do to slow the progression of your CKD. You may be referred to a dietitian through your health service, and they can offer you advice on chronic kidney disease diet. Limit your sodium, salt, intake. There are a lot of foods with added salt. Read the labels and watch processed foods. Cereals and fast foods are often high in salt and table salt added during cooking and at the table. Limit fatty foods, those with high saturated fats and cholesterol. Once again, processed foods, fast food, etc., are high in fat. You may also be advised to limit the amount of protein, red meat, chicken and fish, in your diet. This is so your kidneys don't have to work so hard to get rid of the waste from protein breakdown. Limit the foods you eat that have phosphorus in them, because there is a complex relationship between phosphorus and calcium, and it can cause problems with weak bones. Your dietitian can give you a list of foods to avoid. Foods high in potassium should be limited. All fruits and vegetables contain potassium. There are lists of the potassium content in food, and you can have more of those that are lower than those that are high. Once again, your dietitian can help you find the balance to have a healthy diet. Other lifestyle things you could do: lose weight if you are overweight, stop smoking, cut back on your alcohol. There is a possibility that these measures started in the early stages of CKD. could see you living with CKD but not progressing to ESRF. However, there is no guaranteed time frame as to how many years you may get before ESRF, but everything you do will help. End-stage renal failure means there is no further to go, as your kidneys have failed. There is no longer enough kidney function to keep you alive. You will need a treatment to remove the waste products and the fluid that your kidneys use to remove. So is there life after your kidneys fail? The answer is yes. It will not be the same and may take a lot of adjustment. I have known people on dialysis who have jobs, travel overseas, go on cruises, visit family interstate. Some of the patients I cared for had been on dialysis for over 20 years. Also, you will need medications such as erythropoietin injections to replace the hormone that helps make red blood cells and stop you getting anemia. Phosphate binders that work to bind phosphate in your gut because the dialysis machine does not remove phosphate very well. You will need these medications along with your usual medications. Renal failure treatment choices. Hemodialysis. It involves a machine that will remove the waste in your blood and the excess fluid. You are on the machine 3 times a week for 4 to 5 hours. This can be done in outpatient clinics, or you can learn to do it at home. Peritoneal dialysis uses the membrane that lines your internal organs as a filter. You are taught how to do this, and it is done at home. Ask your doctor or renal nurse for more information. Transplant. Having a transplant is perhaps the best solution of all to kidney failure. It is not a cure. You will need to take anti-rejection medication and continue to keep your blood pressure and diabetes under control. There are 2 types of kidney transplant. Live donor, usually from a relative who is a compatible match. As tissue typing and the anti-rejection drugs improve, people who are not related can sometimes donate kidneys. Deceased donor transplants. The kidney comes from someone who has been killed in unusual circumstances, usually in an accident, is brain dead, and has signed a donor card, or whose family has given permission to donate their organs. It can take years to get a deceased donor kidney. You will need to be on renal replacement therapy while you wait. Palliative care, which is no treatment at all. Some people may choose this, which means they will die. There is support from medical staff, social workers, palliative care doctors and nurses for the person who declines treatment and their family. Your life is changed with this diagnosis. There will be many decisions to make and it can be confusing and stressful. Listen to the advice of your doctors, nurses and dietitians. If you follow the advice given, it can slow the progress of your renal disease. Support groups are recommended for renal failure patients. Write down questions you want to ask, and if the doctors appear too busy, ask the nurse. If you don't understand, ask again. If you do progress to ESRF, your first treatments will be in hospital until you are stable. Whatever type of treatment you choose after that is your choice, and what suits another may not be what suits you. Good luck. There is life after kidney disease, and as with most things, it's what you make it. I do hope this information has helped. To see more videos and learn more, go to our channel Ellen and Michael Moriarty 2 RNs. We hope this helps you. Ellen and Michael Moriarty 2 RNs.